The flu epidemic, a threat to children and adults alike. The flu is a highly contagious and potentially life-threatening illness that affects millions of people worldwide each year. As the seasons change and the temperatures drop, a silent threat lurks in the shadows waiting to strike. The flu can cause severe illness and even death, especially among vulnerable populations such as young children, older adults, and people with certain chronic health conditions. The flu in children are more susceptible to the flu due to their developing immune systems and lack of exposure to different strains of the virus. According to the Centers for Disease Control and Prevention, children under the age of 5 are at a higher risk of developing severe flu complications such as pneumonia and bronchiolitis. The symptoms of the flu in children can vary depending on their age and overall health, but common symptoms include fever, chills, coughs or throat, runny or stuffy nose, body aches, headaches, and fatigue. Causes of the flu. Flu is caused by the influenza virus, which is highly contagious and can spread through the air when an infected person talks, coughs, or sneezes. The virus can also survive on surfaces and objects, allowing it to spread through contact with contaminated surfaces. People with the flu can spread it to others beginning one day before symptoms develop, and up to 5 to 7 days after becoming sick. The flu in adults. Adults can also get infected with the flu, especially if they have underlying health conditions or are over the age of 65. According to the CDC, adults with certain chronic health conditions such as heart disease, lung disease, or diabetes are more likely to experience severe flu complications. The symptoms of the flu in adults are similar to those in children and can include fever, chills, coughs or throat, runny or stuffy nose, body aches, headaches, and fatigue. Care and treatment. If you or your child contracts the flu, there are steps you can take to alleviate symptoms and reduce the risk of complications. Rest, hydration, and over-the-counter medications can help to manage symptoms and make you feel more comfortable. Antiviral medications such as oseltamivir and zanamivir can also be prescribed by your doctor to help shorten the duration and severity of the flu. Prevention. Prevention is always better than cure, and when it comes to the flu, there are several steps you can take to reduce your risk of infection. Getting vaccinated is the most effective way to prevent the flu, and it's recommended for everyone 6 months of age and older. Practicing good hygiene, such as washing your hands frequently, avoiding close contact with people who are sick, and avoiding touching your eyes, nose, and mouth, can also help to reduce the spread of the flu virus. The importance of vaccination. Vaccination is the most effective way to prevent the flu, and it's essential for people of all ages. The flu vaccine is updated every year to protect against the most common strain.